I'm Veronica Marshall at the Capitol. This week on Senate Spotlight, instead of having insurance companies manage your care, what if the conversation was only between you and your doctor?
I'm not doing this because it saves money. I'm doing this because it improves care.
More on the bill that would remove insurers from state health plans. And when someone needs help, first responders are there. But who helps the helpers?
We actually care, and we actually value their service.
How Minnesota developed the best program in the country to keep its firefighters healthy and on the job. That's all coming up.
Senate Spotlight is produced by the Minnesota Senate and Senate Media Services.
1 out of every 4 Minnesotans is on a state-sponsored health care program. That's a lot of people, and currently it's an expensive system to run. But Senator John Marty says there is a way to cut the cost, and that's by cutting out the middleman. Senator, welcome back to Senate Spotlight.
Thank you. Glad to be with you.
Absolutely. So you have a very interesting proposal. You have Senate File 3612, which is what you're calling patient-centered care legislation. And that would remove private insurers, or HMOs, from Minnesota healthcare programs. So that is a lot. Let's start at the beginning. What is our current system?
Sure. The current system, Medicaid, which is the main public program around the country for low-income people, Minnesota has almost 1 million people in that, and we have Minnesota Care for just incomes just above that. So we got 1/4 of the people in the state in those public programs. And those public programs were truly, they're 100% paid for by taxpayers. And these are for very low-income people. And over the years, 30, 40 years ago, people would say, hey, we could save money if we privatize this and we allow what they called HMOs to come in there and they will deliver the care. Instead of paying the doctors and clinics and hospitals and so on, we'll instead have these HMOs come in and we'll pay them and then they'll pay the doctors and everyone. And they were going to manage care, and they call them managed care organizations. And it was going to save money. There's a report out recently from Congressional Budget Office on how Medicare Advantage, the privatized version of the Medicare program, how it's costing much more than 20% more than the traditional Medicare is to the taxpayers. It's a little bit cheaper for some people, but the care problems, whatever. So we have a system since for 30 plus years. We've had a demonstration project. We never evaluated it, never considered whether it was cheaper or more expensive. And we've been doing all these things. In theory, we're managing the patient's care. I'd argue that much of the managing of care of the managed care organizations is managing their claims payments, even if that's contrary to managing care. And we had testimony about how we would do this. The system right now is very expensive, very uncoordinated kind of thing. And I think we could save money by removing the health plans and paying providers directly, and also putting more effort into the care coordination and the case management and the wraparound services that patients need to help navigate the healthcare system.
Okay, so care over claims is what you're saying. Let's talk to your bill. You kind of mentioned a little bit of what it would do. You want to remove those private insurers. Can you explain anything more there?
Sure. Right now, if you are a Medicaid patient, you are given a choice of which insurer you want to use. If you don't pick one, they assign one to you. Then you go through them, and most people are in some health plan or another, and so they get the care, whether it's through their employer or whatever. And they can go to certain doctors, certain clinics, certain others, and they have all these standards and so on. Well, this has caused lots of problems, especially in the Medicaid program, because like one of the providers a few years ago got outbid by another one. So in a whole lot of counties, people had to switch. There was 100,000 plus people had to switch. Medica, the one that took over it at that point, then a year later, they decided they didn't want to stay in that market. So they dropped out. 300,000 people have to switch all their doctors, all their prescriptions, all their everything else. A couple of years later, Medica decided they wanted back in, so another shift. Now UCare, which was one of them, they're out completely. Always this churning and everything else. If you talk to nurses, you talk to people who are working with patients, and they will tell you how much time they spend struggling because, oh, that drug isn't covered under your plan anymore. And switching all that, and the doctor and patient, it's terrible for the patients. It's very painful for the doctors and nurses to see the troubles they have. So we're trying to replace it with a single statewide people are going to go, it's patient-centered. They can focus on them, and we're going to provide benefits to the primary care clinic to help them coordinate care better.
You mentioned how this will help patients and providers. Do these benefits extend beyond those groups? You've kind of mentioned, economic efficiency. So would this have an impact on taxpayers or the state's budget?
Well, first thing to think about is the most expensive item in the state budget. Probably more of the state of taxpayer money goes to education than to health care, but not by much. And in the state budget, when you count state and federal contributions to Medicaid, it's like close to $20 billion a year. Less than half of that's the state portion, but close to $20 billion a year. Our entire state budget is about $35 billion. I mean, 10 of that's federal. But it's a huge chunk of our state budget. And Connecticut, over the last 10 years, has said they've been saved about 14%. And if you save 14% of $10 billion, we're talking billions of dollars in savings per year. So it's huge benefit to the taxpayers. And I'd argue, I'm not doing this because it saves money. I'm doing this because it improves care and keeps our healthcare system from crumbling, which is what I'm afraid it's doing right now.
Who takes over that responsibility?
Sure. Well, first of all, we would have the state would contract basically with a claims payer. And purely administrative, we're calling them administrative services organization. Frankly, some of the health plans might decide to because they've handled claims for smaller portions of the state, but just say for this 1.3 million Minnesotans, 1/4 of our population, you will handle all the claims payments and everything else. You will be the ones who pay the providers, you get the bills and everything like that. And so they would handle the administrative stuff. But the thing that we're doing different than simply kicking the insurance companies out, we are saying some of the money that we're paying that's supposed to be going to coordinating care, we're going to directly do that. Who are we going to do it with? Two ways. One is we're going to pay the primary care clinics, give them a bump in pay to help coordinate maybe basic things like if you had your flu shot, have you gotten these things taken care of, and helping that basic stuff, but also working with the counties. 33 of Minnesota's rural counties have what we call county-based purchasers. They're wonderful organizations run by collective groups of counties. County board members serve on this. Republicans and Democrats alike have given strong support to the county-based purchasers. We think that's a great model, and they're providing all these things to help people get to the right providers. If somebody struggles with mental health challenges, help address that. And so we would be requiring the Department of Human Services to contract with those county-based purchasers to continue doing those services. But we want that to happen in other counties too. So what's being done now by insurance companies, in theory, what we're paying insurance companies to do, we would now be paying directly for, largely to the counties, other nonprofits who can help with mental health or whatever issue, dental, whatever.
Senator, let's talk about support. This idea, you got support from the governor, you've gotten support from the American Cancer Society, but your bill so far only has DFL co-authors. Are you expecting any collaboration from across the aisle?
Oh, I hope so. Let me say a couple of things. One, I've seen over the years we've had a number of Republicans who strongly agree that this is interfering with the care we have. The model I'll give is a state that's done it, Connecticut. It was bipartisan. I mean, I don't know when it passed in 2012 if any Republicans voted for it then, but it's kind of unanimous among the legislators. No, we don't want to go back to what we had. This is much better. It's cheaper and better. So I'd say, yeah, I'm not sure if we're going to have it. I'm not expecting it to become law this year. I'll be real clear about that. We don't have the fiscal note yet. We don't have all the details. But I'm not expecting it to become law this year. I just think we're finally moving in the fact that the governor has said, yeah, we got to do this. And part of the issues about fraud and so on, when they investigated the fraud recently and so on, they're looking at the fraud in the department's managed part, but not in the health plan's managed part. We just haven't been doing that. And their response is, well, we've got the incentive to do it. And I thought, no, the way the contracts under federal law work is if they have an expense where it's fraud, even if they have a criminal fine, a penalty or something, we have to reimburse them for that in the end. So there's no transparency on there. And we want to just have a system, the simpler the system, the easier it is to catch fraud.
All right, Senator, final question. You know, you've said Connecticut is the insurance capital, but we have a lot of people here in Minnesota who work for insurance companies. This idea might make them uncomfortable or feel uneasy. You know, what do you want to say to those guys?
Sure. Well, two things. One, this is not my end-all goal. I want to make sure we have a healthcare system that covers everyone for all their medical needs. We are nowhere close to that. Affordable Care Act tried to cover more people. Everything Democrats and Republicans have done to try and reform healthcare have always been to try and cover more people. And then, oh, we can't give them coverage for dental. That's too expensive. We can't do. I want coverage for every part of the human body, including the mind, the mental health stuff. I want to make sure we cover everything. And in that, we would, on my proposal Minnesota Health Plan, which I think is also gaining support, we would be saying we're not going to have insurance in there. We're not going to have health insurance. You're a Minnesotan, you're covered. And you're going to pay premiums based on ability to pay, but you're not going to have co-pays and deductibles. It's going to be a simple system so you can go to the doctor, the dentist, or the chiropractor whenever you need it. The goal of a healthcare system should be to keep people as healthy as they can be and get them the care they need when they need it. And in that case, we wouldn't have insurance companies. And as you mentioned, we have some very large ones, and the largest one nationally in here. And that would be displacement. They would not be, they don't sell, they're not in the public programs now. They wouldn't be in a lot of business here in Minnesota. And that would be layoffs of people. Well, under that system, you have to figure out, if we're bringing down the cost of healthcare by billions and billions of dollars in that case, that can pay doctors more, can pay more for this. And frankly, we have a shortage of so many other things. Those folks, my bill for that would be providing retraining funding and dislocated worker benefits. And you don't even need to retrain all of them. The former head of United Health Group was a doctor. He doesn't need retraining. He could just go practicing. We couldn't match his $105 million a year salary, but we want to make sure we take care of people. I want to treat people who are working for insurance companies and people who are processing claims. I want to make sure they're all treated fairly. But we don't want them interfering with care at a great expense to the public. Same thing, pharmaceutical industry. We need the pharmaceuticals, but we don't need to pay exorbitant prices to get it. We should pay fair prices, and that's what we want, a fair, logical healthcare system. And so, yes, I'm not arguing that the health plans should like this, but in the long run, they and their families would have better healthcare with a system like this.
Senator, thank you so much for the conversation and for your time.
My pleasure.
When it comes to the health of our hometown heroes, Minnesota is second to none. Our Hometown Heroes Assistance Program, which supports fire service members across the state, is the best in the nation. Retired firefighter, fire chief, and fire marshal Senator Jeff Howe was the driving force behind the program, and he shares its many successes and what's next. Senator, thank you for being here.
No, thanks for asking me. It's a pleasure to be here.
Now, Senator, during your time in the fire service, you obviously became well acquainted with some of the issues that the people in our fire service face, especially regarding their health. And I know that's been something that you've really attempted to improve since you've been here in the Senate legislatively. So talk to me about some of that work you've done.
Well, yes, we've, you know, a lot of our firefighters end up with a lot of occupational hazards. You know, there's a lot of cancer, there's a lot of psychological. I've suffered with some of that myself. So when you go to all these traumatic scenes, that stuff sticks with you. I can remember one incident that every time I closed my eyes for about 3 days, that's what I seen. So very stressful, and back in the day, there was no place really to go for that. So with that, we started looking, and these other firefighters brought to us this Hometown Heroes assistance program, that thought. So, and it was an honor to be part of that, and part of that, moving that through. And so I hopefully here, and we've seen that program provide a great deal of success and value to a lot of our firefighters throughout the state.
Senator, tell me more about that program. Who is it open to, and what resources does it offer?
Well, it's open to, there's about 20,000 firefighters throughout the state, both career, paid on call, volunteer, and this provides this assistance to all Minnesota firefighters. So it encompasses all of them. And it provides not only, it provides a up to a $20,000 payment, depending upon what occupational hazard you've come in, whether you've got cancer, heart attack, those types of things. It varies in the amount. But it also provides help in training for preparing you for some of these events that you're going to face, so you're better prepared for mentally for some of the events that you might see, some of the tragic things that you might have to deal with. So it prepares them for a lot of that. It's probably the most encompassing program in the nation.
It actually has earned a title very similar to that. It has been called the most comprehensive firefighter well-being initiative in the nation. That is incredibly impressive. Tell me about that.
Well, I don't think anywhere else that it provides the training for the awareness on cancer, the stuff on cardiac disease, emotional trauma. It's got a whole host of training that they go out free of charge to provide to fire departments. And then when one of these, if you are an active firefighter and come down with cancer, and there's a number of cancers it covers, they actually provide funding for those families so it helps them deal with that cancer that they're dealing with. The other thing is it provides actual counseling for different events, and I think there's up to 5 counseling sessions free of charge per year. So it's really helpful for not only the firefighter but their families, because the families go through this too. So it helps them deal with these incidences.
The most recent iteration of the bill received unanimous bipartisan support in the Senate and in the House. That is a feat during these times. How did that happen?
It doesn't happen very often, and so it is unique, and I think people really see the value and have seen the value of this program as we've rolled it out and as it continues to provide assistance to all of our firefighters out there and first responders. And as you know, we struggle to keep them in boots. We struggle in the recruitment. I think this is an excellent recruitment tool to actually know that we actually care and we actually value their service. And I think this is an excellent way to assist them in staying in the fight and staying in and keeping public safety in the front of people.
You have been recognized for your work on this, for the assistance you have provided. You know, the Minnesota Fire Association Coalition recognized you. So I think it's really safe to say that this work is part of your legacy. How does that feel?
Well, as this is my last year, that it feels good that there's a program out there that I helped, and there was a lot of people involved in making this happen. And so this isn't, I was just honored to be a small part of making this thing happen, but it is true that we've worked very hard to make this a good program, and it's an honor to be recognized, to be a small part of making this a reality.
It's a good program. Could it be better? What do you want to see happen for it next in the future?
Well, as this thing is providing great assistance to the current firefighters, there are retired firefighters that continue to deal with this. I was just at a luncheon with some retired firefighters that I worked with. There was probably 20 of us there, and I noticed that one of my fellow colleagues was missing part of his nose, and he said, "It's my 20th cancer surgery." And I said, "Holy smokes, how many of you guys have all dealt with this?" And there was probably 2/3 of them that raised their hand, which we don't have a program really for those retired firefighters that we need to look at. So that's one aspect we could look at. But the other aspect is this works very well to help reduce PTSD and those anxiety issues that we deal with the tragic events, and it's been working very well with the firefighters. I'm wondering if we could do this for possibly the peace officers, the licensed, our police officers, and see if we can start a program that can deal with them or in fact maybe incorporate them into this program. And I think it would be economical. It'd continue to keep our administrative costs down. So that's another avenue that we're exploring to see if that's a possibility.
Senator, you've served in the Navy, in the Minnesota Army National Guard, as a firefighter, a city councilman, as a representative, and as a senator. You have a legacy of service. What has inspired you to do all of this?
Well, you know, if you ask my wife what I do, she says I'm a public servant. And I truly believe that it's an opportunity to give back. You know, I was not a bright student when I was in high school. I was probably number 43 out of 46 kids in my high school class. Probably one of the last things people would think I would be doing was sitting here as a senator in this state. But it's important to me to actually give the opportunity, and the good Lord has given me opportunities to serve in a number of different capacities. And I'm honored to have that opportunity to serve not only the people of my community in different fashions, but the state and the nation. You know, that's truly an opportunity to serve. Not many people get that opportunity, and you know, it's truly an honor. It's not a. That's all I can say. It's a privilege to be able to serve.
Senator, that spirit of, live to give makes you the perfect person to be here. And you mentioned you plan to retire, so we'll miss you. But what's next for you, Senator?
Good question, but I've been here 14 years, which is longer than I anticipated. With 38 years in the military and 27 years in the fire service, I think it's time to spend some time with family, maybe do some little traveling, and I still got a business to run, so. Still active.
Keep him busy. Oh, Senator, it's been a pleasure. Thank you for being here.
Thank you for having me.
For some first responders, what happens in the field doesn't always stay there. Sometimes the trauma of what they see at work stays with them and impacts their mental health. But here in Minnesota, these first responders now have a way to process those emotions that's a little outside the box, because it's actually in a barn. Figaro was fast, strong, and successful until he wasn't.
He raced all over the country and he got injured. He's tried many different second careers. Jumping, did some amazing physical careers, and then he got really injured. And so he has had to go through identity changes and shifts, put on a different uniform.
Sally Mixon says now Figaro has a new perspective, a new uniform, and a new job, saving lives.
His true identity is who he is, and he's had to learn that. And our first responders have to learn that. Their true identity is not that uniform.
Figaro is one of a handful of retired racehorses helping Minnesota first responders process their trauma. First responders like Angela Casey.
I had a very traumatic call about 4 years ago, and it was one of those things where I was like, I'm good, I'm fine. And after a few months when it wasn't solving itself, and I could see that it was taking a toll on my mental health, and I wasn't being the best mom that I could be, I wasn't being the best wife I could be, I wasn't being the best cop that I could be, that's when I reached out and said, you know what, I think I need help, I think I need to try something, anything.
What she found was Abijah's on the backside, an approach to therapy that gets first responders out of their heads and into the arena.
It's not talking about maybe the reasons why you're anxious or, like normal talk therapy. It's about seeing the way that you're feeling in these animals and then being able to work it out in that way.
For a law enforcement officer struggling with anxiety, instead of talking about anxiety, there's a few things that happen. They're going to talk about this character out here that might be representing anxiety. It might be running, it might be pacing. It takes their anxiety and it puts it out there. We're touching things, we're smelling things, we're walking through things that can represent, we're hearing things that can represent a lot of parts of their story. It's a full body experience versus just thinking. There adds a little bit of humor to it as well, that really kind of takes down some walls and some barriers for them, which we have found to be significant.
And one day during a session, Sally and myself started talking about faith. And you know, when I'm struggling with anxiety, where does my faith come into place? At the time, I only used faith when I needed it. My faith needed to be a bigger character. And as I said that, Finn moved right into the middle of the arena and just looked at me. And he became my faith horse. If I'm struggling with my faith, or if I feel like I need more faith, I think about Finn.
Experiences like these have kept Casey coming back to Abijah's and on the job. And her success story isn't a surprise in these stables. Out of the more than 130 first responders Abijah's has served, Mixon says all but 4 have remained on active duty.
We have officers that have shared they probably would have retired or quit a year ago, and they're still doing it, and they're finding their passion again.
But this program wouldn't be here without help from a different herd.
We in the legislature are very numbers driven, and we want to fund programs that are successful, and you can't argue with the success of this program. When you look at the science behind it, when you look at the people that are providing it, and more importantly, when you hear the testimonials of those that have been helped and the miracles in their lives that have been performed, it's how can you not be supportive? One of the stories that moved me was there was a first responder, and she was in her first therapy session. The horse came up to her and laid down, and she burst into tears because she had contemplated suicide the night before, and she felt like the horse was playing that out for her. Now she's back on the job. She's there as a mother and a wife and a daughter. The fact that we can keep them in these roles, we can keep them providing for their families, we can keep them serving their communities, I think it's a wonderful benefit for the entire state.
Senator Eric Pratt authored Senate File 901, which funded the program. After that, he needed allies of his own to get it across the finish line.
I looked specifically for co-authors that were interested in mental health or that had that first responder background. So Senator Howe, Senator Seeberger, and Senator Hoffman met that threshold, and quite honestly, they helped me advocate for the bill. Supporting our first responders is not a partisan issue. In committee and all the stops that it made, it had a tremendous amount of support.
To have his support and to kind of be the wind in our sails, we would not be here. We just wouldn't, and there would be hundreds of first responders that wouldn't have got this kind of help without their support. So, I mean, a thank you doesn't do it justice.
And for those still in need of support,
do your research, come out and see what's happening. Talk to the people that have gone through the experience, and it's life-changing.
A healthy horse requires a healthy herd, which is like people. You're not alone. You have a herd. You have people that get you. We're part of your herd.
Hard calls don't stop coming, so it's always nice to have Abijah's be that steady rock in my life. This is such a family here, and it's cool that my family includes someone like Sally and someone like Dina, along with all of these horses that have helped me so much.
There's a herd and a horse just waiting to help.